to your Babypedia channel and one-stop destination for all your queries related to pregnancy, childbirth and baby care. I'm Ms.Shweta Vishnu, a certified birth professional and also the core team member of Babypedia. Welcome you all once again. So today I'm going to be talking all about episiotomy, why is it being followed, and also I'm going to give you 10 tips on how to handle the episiotomy easy peasy and how to roll on through your postpartum phase with care. So why wait? Let's dive into the content. What is episiotomy and why is it done? Episiotomy is a surgical incision or a cut made by the doctors on your vaginal opening towards the anus to make the vaginal opening a little bit more wider so that the baby passes through it a little bit more easier towards the earth side. So you must be thinking, episiotomy is just a cut or an incision. It must be healing very quickly. Yes, you're absolutely right, but not without a proper care. So here I am listing out 10 points to help you pass through the postpartum phase in a breeze. Number 1, take rest. As a mother, you need plenty of rest because your body has worked so hard to bring the child beautifully towards the earth side. So all that you can do now is enjoy, rest, and feel the passion and compassion from your neighbors, friends, and family. Typically, a normal delivery takes around 7 to 10 days to heal from the episiotomy. So all you can do this while is to rest and move less. Do not move very frequently. You can't expect your body to run a marathon the very next day, isn't it? So take it slow and move slowly. Move around just to do the basic necessities. Do not jump into a marathon. Then ask for help. Do not shy away from asking for help from your family, friends and neighbors. Some of the helps you can ask them is to bring the baby towards you for feeding, or asking them to carry the baby when the baby is crying or whining. Ask them to do some pampers change for them. Give the baby a bath. Your motherhood can wait a little. All you need to do is to rest for about 7 to 10 days and then you can be upright and do all the basic necessities that your baby will require. Do not lift any heavy items because handling a heavy item would put on the pressure down to your pelvic floor muscles, which in turn will reflect on your episiotomy stitches. So be sure that you do not carry any heavy items, not even you holding your baby or lifting your baby from downstairs. Do not sit on the stitches. Sitting upright on the stitches will take time to heal the episiotomy wound. So make sure that you prop yourself with soft pillows or cushions or a donut-shaped pillow, or instead you can take a towel and roll it around and shape it according to a donut and sit on it comfortably so that there is enough space for your episiotomy wound to breathe and heal on its own. Number 2, always have a check on your breastfeeding position. Make sure that you're always on a reclining position while breastfeeding, or you can also try the side lying position while breastfeeding so that there isn't much of pressure on the episiotomy stitches. Feeding the baby while being on a reclined position or lying down position is not going to affect the baby, or it's not going to be harmful for the baby. So mothers, always make sure that you breastfeed your baby at your comfortable position and do not forget to burp your baby after each feed. Number 3, wear a maternity pad. There are lots of products available exclusively for the postpartum stages. So kindly make sure that you do your own research and find a suitable product for yourself which will ensure that you have a hassle-free maternity period. Make sure that you change your maternity pads every 2 to 3 hours to avoid infection. Once you get an infection, it will be really hard to heal off from the episiotomy wound. Always make sure that while wearing your maternity pads that you do not rub on to your episiotomy stitches, because rubbing onto the stitches will cause friction and it will take a long time to heal by themselves. Number 4, maintain hygiene. Every time you use the restroom, make sure that you clean the episiotomy stitches with water, with the lukewarm water of your choice. Please make sure that you do not apply pressure from the faucet. Instead, make sure that you pour a mug of lukewarm water over the area. Once you've cleaned the stitches with lukewarm water without much of pressure, make sure that you air dry the stitches. If there isn't enough time for you to air dry, take a tissue and dab dry the area. Please make sure that you do not rub the stitches. See to that the area is not wet or moist. Make sure that you apply the antiseptic ointment or the solution that the doctor has prescribed. Please do not be lazy. Make sure that you apply the ointment very frequently and keep the area very clean. If possible, try to air dry the wound as much as possible. Number 5, take time for yourself. The first 7 to 10 days after a vaginal delivery is very crucial for a mother to take care of herself to heal from the wounds or stitches. Make sure that you find enough time for you to be away from the clothes and let the wound soak in with a lot of air exposure. You will be very surprised what an air exposure would do to your healing process. So remember, the air exposure would definitely do wonders in healing your episiotomy stitches. So make sure that you provide as much as time for yourself as you provide for your newborn kid. A healthy mother would definitely be able to serve the baby well. Number 6, avoid tight clothes. As much as it's been said, your body has gone through an entire process of bringing birth to a newborn baby. So the body must be really tight. So make sure that you wear loose clothes so that it provides a better blood circulation from top to bottom, and also it gives you enough air circulation. You'll be really surprised to know for a fact that enough air circulation and wearing light clothes would heal your body faster and quicker. Always ensure that you wear light undergarments or change your maternity pads very frequently, and keeping your body for enough air exposure would also heal them quickly. Number 7, bowel movements. Having a constipation is going to make your postpartum stage even more complicated in comparison with your normal stages of your life, because pushing and bearing down puts a lot more pressure on your pelvic floor muscles, which in turn puts a lot of more pressure on the episiotomy stitches. So make sure that you get prescribed stool softeners from your doctor during the initial stages, and also make proper dietary changes like a lot of intake of fiber-rich food will help you to have an easy bowel movement. Drinking a lot of water makes a whole lot of difference in easing down your constipation. Make sure that you follow some comfortable positions while relieving your stools, like you can follow the squatting down position, or you can have a stool beneath your legs so that your knees are always above the hips while you're squatting. So try to follow these few tips and tricks to avoid the constipation side effects. Number 8, change your positions very frequently. For example, if you're lying down for a longer period, try to make sure that you turn towards your sides, or if you're on the sides for a very long period, try to prop yourself in a reclining position. The basic concept is keep changing your position very frequently so that too much of pressure is not applied on one particular area, which in turn puts pressure on the episiotomy stitches. Changing your position very frequently also helps you with the bowel movements, because remember that too much of movement during the initial stages is not really good, but you need to have enough movement to keep you upright, or enough movement to facilitate your bowel movements, or enough movement to ease down the pressure from your episiotomy stitches. Number 9, avoid sexual intercourse. Having an intercourse is going to create a friction or a rupture on the episiotomy stitches. So it is better to avoid sexual intercourse during the initial period or during the healing period of your stitches. I'm sure. Number 10, quick tips to heal from the episiotomy stitches. always make sure that you sit on a soft pillow or a donut shaped pillow. If not for a donut shaped pillow, make sure that you roll your blanket on a donut shape and sit on that so that there is enough area between the floor and your episiotomy stitches. You can also apply some witch hazel along with aloe vera gel onto your maternity pads, pop it into the freezer for a couple of minutes prior to you using the pad. The cold sensation while wearing the pad or the cold sensation over your stitches will help to heal faster and quicker. You can pour water on your vulva while urinating. This will prevent you from feeling the sharp burning sensation. Try keeping your vulva as dry as possible. This means that you have to give enough air exposure and also change the maternity pads every 2 to 3 hours to keep the area dry and to escape from infections. I'm sure that all these tips and tricks would help you to recover quickly from your episiotomy stitches, and we also have a detailed course on how to handle your postpartum stages, which is available on a platform which has a lifetime access as well. So if you like this video, please do not forget to like the button or click on the notification button as well as the subscribe button. So thank you and see you in the next video. Bye.